Melanoma is a vast and complex form of skin cancer that begins in cells called melanocytes. These cells are normally in charge of producing the pigmentation for your skin. However, if these cells begin to divide uncontrollably, also known as proliferation, melanoma will arise. There are many influential features such as genotypic, phenotypic, and environmental factors that all play a role in determining how at risk you are of developing this disease. For example, an individual who presents the phenotypes of light pigmentation, blonde or red hair, and green or blue eyes, this individual would be at a higher risk of developing melanoma than someone of opposite phenotypes. However, it should be noted that everyone can still be susceptible to this disease no matter what phenotypes you present. Continuing on, since the late 20th century, it has been widely known that the environmental factor, the sun, is an obvious cause for skin cancer. Exposure to high-intensity ultraviolet radiation from the sun has been shown to cause skin cancers spanning from the cutaneous cell level down to the basal cell level. By looking into genotypes, it is now known that individuals who have already had either melanoma or another form of skin cancer previously in their life are at a much greater risk of developing it again in the future. In fact, there is a 20 to 50% chance of having melanoma reoccur depending on how severe your initial diagnosis of melanoma was. Additionally, having a weakened immune system from either a medical condition or the medication prescribed for a condition is another variable which can enhance your chance of developing melanoma. And lastly, individuals who have large atypical looking moles on their skin pose a greater risk of having or developing the melanoma disease. We are now going to adventure into the four main types of melanomas which you can see presented as dot points on this slide. Firstly, we will look at superficial spreading melanoma. In appearance, this type can either be flat or raised with distinct irregular shaped borders. This type of melanoma also has a variance in colour ranging from white to black. Superficial spreading melanoma develops from previously benign moles anywhere on the skin surface. This form of melanoma is most common with a 70% prevalence. Secondly, we will look at nodular melanoma. In appearance, this variance can be black, blue, pink or red in colour and is characteristically raised and firm to touch. The development of nodular melanoma starts on the skin surface and grows downwards into possible tissue, lymph nodes and even bones, hence the reason for it being firm to touch. This form of melanoma is second most common with a 10 to 15% prevalence rate. Additionally, we'll now look at acrolentigenius. At first, the appearance of this melanoma is smooth with a dark pigmentation, later followed by a not so smooth, rough, thicker and uneven surface. Development of this melanoma is aggressive and develops from malignant melanocytes found along the basal layer of the epidermis. It is commonly seen to grow on the palm of your hands, soles of your feet, along with a few other parts of the body mentioned on this slide. Acrolentigenius was found to have a less than 5% prevalence rate. The fourth variant of melanoma we'll be looking at is uveal or ocular melanoma. This form of melanoma affects the eyes, presenting dark spots on the iris and in some cases changes in pupil shape. This form of melanoma develops from proliferation of mutated cells in the eyes and unfortunately has a 30 to 50% death rate. This is because it begins to form in parts of the eyes which cannot be seen externally until it becomes more severe and life-threatening. Luckily, this only has a 3% prevalence rate. Diving into familial melanoma, there are two main genes we'll be talking about, and if you inherit the mutated version of these genes or develop mutations in these genes throughout your life, you are at a far greater risk of developing melanoma. The genes CDKN2A and CDK4 both act in mediating the G1 phase of the cell cycle along with suppressing tumour growth. Therefore, if these genes are mutated, cell growth is no longer mediated about the G1 phase, resulting in proliferation of these cells. These mutations often lead to melanoma, and in the CDKN2A gene, it can also result in neural system tumours. To finish off this beginner's guide to promoting awareness of melanoma, here is a list of what we believe are the most pertinent preventions and treatments of this disease. Preventions include self-examining your own skin, particularly moles, to watch for any increase or change in shape and size. Knowing your genetic history can also be helpful in knowing if you are predisposed to obtaining melanoma. And lastly, by 10 years old, you should be getting annual skin screening tests done. Now, onto treatments, which include surgery, radiation therapy, chemotherapy, and targeted therapy drugs. That concludes our presentation today. Thank you for listening.